We're going to go ahead and start 4B, the second part of our vascular system on our skull. This part is the veins. I'm going to use a navy blue or a really dark blue puffy paint for this, and you can see how the ones I've done, they follow along similarly. It's not quite as complex as what we had to learn for the arteries, and then I also used my pencil to mark those areas before I painted them. So what I did is I started with the facial vein, and it drains eventually into the internal jugular vein, but it begins at the medial corner of the eye here, where there is the junction of the supratrochlear vein and the supraorbital vein. So those come together. It also anastomoses, which I need to mark as well, with the ophthalmic vein, which runs through the eye. And the significance of that is the ophthalmic vein does communicate with the cavernous venous sinus, which is key for spread of infections to the brain. So we'll be discussing that a little bit more as we go along as well. So the facial vein receives branches from the same areas of the face supplied by the facial artery, and anastomose with deep veins such as the pterygoid plexus, which is in this area here, which we'll discuss a little bit more coming up, and also anastomose with the retromandibular vein, which runs along the back side of the mandible there, and before it joins the internal jugular vein at the level of the hyoid. The facial vein, as it comes down, it includes tributaries, the superior labial vein, sounds familiar, similar to the artery. We also have the inferior labial vein, and we have the submental vein, and as well, if we kind of turn this around carefully, we have that lingual vein that drains the tongue and the floor of the mouth. And these deep lingual veins are the ones that you can see if you lift your tongue up. You'll see those large purple veins on the underside of your tongue. Our next vein is the retromandibular vein, which is here. This area right behind the mandible, as it says. It forms the external jugular vein from a portion of its root, and it's formed by the merger of the superficial temporal vein and the maxillary vein, which is going to be the same as maxillary artery on the back side of this condyle. Okay, so these two come together to form this retromandibular vein, and it emerges from the parotid, and then it travels inferiorly. It drains areas similar to the superficial temporal and the maxillary arteries. That as it goes inferior to the parotid, it divides into the anterior division, which joins our facial vein here, and then also has a posterior division that travels down on the surface of the sternocleidomastoid muscle, and then it becomes the external jugular vein after joining the posterior auricular vein. Next we have, as we just discussed, the superficial temporal vein, which drains the lateral scalp and is located, superficially located, and it drains into our retromandibular vein. And then the maxillary vein will be discussed next. The maxillary vein is deeper than the superficial temporal vein and begins in the infratemporal fossa by collecting blood from the pterygoid plexus. So if we spin this mandible around, just as we marked the maxillary artery, I'm going to mark the maxillary vein. So just realizing that does connect here into where I marked the pterygoid plexus here in the infratemporal fossa. So through the pterygoid plexus, it receives the several veins, including the middle meningeal, the PSA. We also have the IA, the the inferior alveolar vein and other veins. And then it's going to merge with our superficial temporal vein and drain into and form the retromandibular vein, as we've talked about before. So maxillary artery would be right about here, branching off, joins with that retromandibular or superficial temporary to form this retromandibular vein. The pterygoid plexus of veins, as we just briefly discussed, is a collection of small anastomosing vessels, again in this infratemporal fossa. It's located around the pterygoid muscles and surrounding the maxillary artery on each side of the face. It also, an anastomose was with the facial and the retromolar veins. The pterygoid plexus of veins also protects the maxillary artery from compression during mastication, and this plexus fills or empties to accommodate changes in volume to the infratemporal fossa when the mandible moves. It drains the veins from the deep portion of the face and the middle meningeal vein, which we just discussed, and these drain into that maxillary vein. So a little bit different setup than we had with the arteries. Portions of this plexus are near the maxillary tuberosity. So this is a concern, something to keep in mind as we're learning how to do the posterior superior alveolar injections. If that is pierced during that injection, which would be around this tuberosity here for the PSA foramen, it could cause a hematoma or a bruise. It also can be involved in the spread of infection. If there's infection in this area, say on this tooth, and your needle travels through that infection can spread into that plexus, which is scary because then that also communicates up here with the venous cavernous sinus within the brain. Next, we will discuss the posterior superior alveolar vein. It does drain into that pterygoid plexus, so this is kind of that main hub, essentially, for the veins in a lot of the facial areas. It's formed by the merger of the dental and alveolar branches, draining the pulp and periodontium of the maxillary teeth. And let's see, we'll talk about inferior alveolar vein next. We talked about that a little bit before with the so our inferior alveolar vein here is going to be formed by the merger of dental, alveolar, and mental branches in the mandible, draining the pulp and periodontium of the mandibular teeth, and again draining. This actually doesn't drain directly into the maxillary vein, it drains into the plexus, which drains into the maxillary vein, like we discussed before. The mental vein enters just as the artery came out. We're going to have a vein that goes in. I still need to paint that. So we have the mental vein that enters the mental foramen after draining the chin area and outer surfaces of the mandible. So then it's going to join the inferior alveolar vein and then go up in that plexus and then go through that maxillary vein like that. So we do have several sinuses within our skull. The dural venous sinuses receive blood that is circulated through the brain and the orbit or the eye. Blood from these sinuses empties into the internal jugular vein, which is here, and then exits the skull through that jugular foramen I just showed you between the temporal and occipital bones. Our main one, I don't really expect you guys to know all of these marks here. That's, you know, it is important, but the one that's mostly that we're going to concentrate on is the cavernous venous sinus, because it's the most important to us as a dental hygienist. And the reason why is because, again, it is directly communicates with that pterygoid plexus of veins right up to this. You can see how that, you know, that communicates there. So they are located on each side of the body of the sphenoid bone. so each side of that little saddle there. And they communicate with each other. They also communicate, of course, with the pterygoid plexus and the superior ophthalmic vein, which we can see here. And so the big thing is that it can be involved in the spread of infection from the teeth or the periodontium up into the brain, which can cause some serious problems.